with us today. At this point, the floor is yours.
Okay, thank you very much. Hello, everybody. Thank you for spending part of your Friday. It's good to see some old friends and some new faces participating today. Let me go ahead and share my screen so we can get started. Okay. So I want to mention that we will have available copies of the PowerPoint presentation, including a printer-friendly handout. And also, for those who are interested, I'll share a copy of an example life care plan. So that will be available to all of the participants today. The idea today is to have an introduction to life care planning for rehabilitation counselors. I know that there's a variety of expertise in this web meeting, and I'm going to ask Christine to post to the chat a little question about your relationship to life care planning, just so that we can get an idea of whether we have folks in here who have no idea what this is, and we'll cover things so that you walk away with a better idea, or all the way to people who are certified and teach it and stuff like that. So if you could give me an idea, that would be very helpful. Let's go ahead and move on to the content. Okay. So what we're planning on doing today, oh, it jumped ahead. Hopefully this is what you're looking for. Letting you know that life care planning is a process for systematically identifying and quantifying services needed to maximize function and quality of life while proactively minimizing complications and costs for people with significant disabilities. So the knowledge and expertise of rehabilitation counselors is a great base on which to develop a specialty practice in this area if you're interested.
Recording in progress.
Okay. And an overview. I'm hearing a little echo. Hopefully you folks aren't. Okay, so the echo's gone. So we'll have an overview of the life care planning process and benefits of having a life care planning document that serves as a kind of roadmap for services needed over time. And we'll look at how this is helpful from the perspectives of people with disabilities and their families, hiring parties like attorneys, special needs trust administrators, rehab hospitals, etc., and professionals providing life care planning services. Okay, learning objectives. We want to learn what life care planning is, be able to define it, discuss ways that life care planning services can benefit people with disabilities, and understand how to build on rehabilitation counseling skills and expertise to engage in the specialty area of professional practice if you're interested. Okay. So what is life care planning? The life care planning process uses a systematic methodology. Very systematic, not fly by your pants, to identify and quantify the multidimensional disability-related needs. Many different aspects of life are affected by disability. We look at the multidimensional disability-related needs of an individual who's experienced catastrophic injury or who needs significant disability-related services throughout their life. So the results of this process are summarized in a life care plan document. So what is a life care plan? It's an outline for families and service providers to see what service needs are expected at what points in time into the future. It has been defined by multiple organizations that have endorsed this definition, been defined as a dynamic document based on published standards of practice, comprehensive assessment, data analysis, and research, which provides an organized, concise plan for current and future needs with the associated costs for individuals who experience catastrophic injury or have chronic health care needs. So the purpose of life care planning is to serve as a kind of roadmap to inform the person with a disability, her or his family members, and service providers about the anticipated disability-related needs and services necessary at which points in time to meet those needs. So proactively looking at what kinds of things are going to most help maximize function, improve quality of life in a timely manner at what points in time. So the goal of the life care planning process is to design a recommended set of services that will maximize function and quality of life for the person with a disability while minimizing overall costs, which can be helpful for families, for payers, insurance companies, things like that. Maximize quality of life and function while minimizing costs. Instead of management by chaos, we proactively plan for how to most effectively meet those needs. Proactive prevention of complications, minimizing reactive response to chaotic crises. That is a hallmark of life care planning practice. And life care plans should address not only medical needs, but also psychological, vocational, educational, social, and independent living needs as well. So this is comprehensive. The process of life care planning uses a consistent transdisciplinary methodology to gather disability-related information about an individual, integrate information from multiple sources, request additional information, such as from the individual with a disability, from family members, and from current treatment providers, review relevant research literature, develop recommendations for services, research the availability and the cost of such services in the individual's local area. Okay, we say, okay, well, you really should have physical therapy to address such and so. Well, who in that area can provide that kind of physical therapy, and what does it cost? Okay. Then synthesizing this information into one comprehensive document. That document, Life Care Plan, is usually presented in the form of a narrative summary followed by a set of tables. And each page of the tables focuses on a different dimension of disability-related needs and services. The categories are presented separately for two main reasons. First, they help consumers, family members, and service providers to understand the many areas of attention needed to prevent complications and maximize quality of life. And second, they tend to be associated with different growth rates for projected costs, facilitating analysis by an economist or a financial planner. The usual categories that show up in those tables. You may see different life care planners using slightly different titles, but usually these are the general categories. Projected health-related professional evaluations, projected therapeutic modalities. Now, usually those evaluations and modalities should go together. It doesn't make sense to have a physical therapy evaluation if you're not going to provide physical therapy services, but they are separated because there are different growth trends and things like that for them. Diagnostic testing and educational assessments, wheelchair requirements, wheelchair accessories and maintenance. Those have different growth rates. And not everybody will need all of these categories, but because it's a consistent methodology, we look at each area. So like when I'm doing a life care plan for somebody who's blind, who isn't using a wheelchair, I still have that wheelchair requirements part of the table and note in there that this disability does not affect the individual's need for a wheelchair. So no wheelchair is included in the plan. Separate category for orthopedic equipment needs. Another category for orthotics or prosthetics. Another category, disability-related home furnishings and accessories. Do you need a specialty bed? Do you need the variety of things that may need to be modified, and accessories may be needed to make the home accessible. Aids for independent function, and these may be very simple, inexpensive ones, or rather complex, more expensive ones. There's a whole variety of a continuum there. Drug and supply needs, home care or facility-based care needs. This is usually one of the most expensive parts of the life care plan. Are you going to need, for example, 24/7 home care? If so, at what level? Are you going to need somebody who is a licensed professional, licensed practical nurse? What is required and why? So exactly what are the needs there? And sometimes we will end up looking at options. So if, for example, a family wants to keep the person with a disability in the home, we provide what it would cost to do that safely. And then we also provide the information about what it would cost in a facility-based care situation. And it may be one is more expensive than the other. It may be one works better for the family than the other. We try to provide options. If, for example, the medical providers all say this person really should be in a facility, but the family says, no, we want our loved one at home, providing both options so that people can make informed decisions can be important. Projected routine future medical care is separated from future surgical treatment or other aggressive medical care. Again, different growth rates, different, well, just helping people understand. Yes, we've got routinely, you're gonna, let's say you're blind, you're going to need to regularly visit your ophthalmologist to check on the progression of your vision loss. But if surgery is recommended for your eye condition, that's a separate category. It's different from the routine. Health and strength maintenance. Some people used to call this category recreation, but to help others understand its importance, it's not just, oh, let people have fun. Being able to engage in activities that develop your strength, that maintain your health, is very important in terms of rehabilitation outcomes. So it's not just having fun, although having fun is important. It's also maintaining that health and strength. And then vocational services is a category within the life care plan. Too often, folks who don't have vocational expertise don't do a good enough job with the vocational section of life care planning. And so they need to be collaborating with people like us, with rehabilitation counselors, to better understand what are the vocational services needed. Too often, lawyers will say, well, this disability is so catastrophic, there's no way this person could ever work. So we're just going to assume work is not an option. And so no vocational services are needed. We all know better, right? There are ways to have people engaged in work and provide services that are needed to empower folks to be able to do work worth doing. And even if it's not feasible to be employed competitively, engaging in some kind of worthwhile activity, something meaningful in life is very important. So productive activity, if not work, is an important goal here. So some of the basic tenets of life care planning. First and foremost, life care planners are rehabilitation professionals and educators. Our job is to help educate people about these disability-related needs and what happens if we don't address those needs. Okay, if you are using a wheelchair and you don't have an appropriate cushion and you develop pressure ulcers, what are the consequences there? How important is appropriate cushioning? How can we focus on the importance of proactive attention to reducing complications? Another basic tenet, all plan recommendations should clearly relate to patient-specific evaluation data. There should be no one-size-fits-all plan for folks with spinal cord injuries or folks with hearing impairment or whatever. It should be clearly related to data specific to this person. It's highly personalized. We should assume the probability of success of recommendations. If we provide funding for an appropriate seating system, appropriate cushion for a wheelchair, we should not assume that we will also need surgical intervention for pressure ulcers, okay? We want to assume the probability of success of the recommendations. If a recommendation is more likely than not to result in a positive outcome, we should assume the success of that in the planning instead of put the very, very worst possible options, even if it's not more likely than not to be in there. Life care plans specify provisions throughout life expectancy and cannot depend on any one individual service or supplier for fulfilling the plan recommendations. So you need to identify multiple suppliers. Why? Well, for one thing, we can't guarantee that that same individual is going to be able to provide that service for that cost 20 years from now, right? And that includes a spouse, okay? If we say, oh, well, the spouse will take care of this. Well, what if the spouse isn't there? What if the spouse gets hit by a bus? What if they get divorced? We need to look at how can the services be provided throughout life expectancy independently of relying on any single individual or supplier. Recommendations must consider disability, individual, family, and regional factors. So if this person lives in rural Montana, there aren't going to be a lot of sign language interpreters in their neighborhood, right? Okay, so looking at regional factors, looking at what are the needs of the family as well as the individual, and not just one size fits all for a particular disability. Recommendations are proactive, not reactive. So what can we expect with each particular individual based on their combination of disabilities, based on their life circumstances? And here, in part, we need to look at the literature to see what can be expected, right? We want to be proactive. What are standards of practice? What are the best evidence-based protocols for addressing the concerns that this individual is likely to face? Recognize the benefits of maximizing patient potential. Okay, we want to maximize quality of life and function while minimizing costs. But it's not just minimizing costs. We also want to maximize the potential, remove barriers. Okay. life care planning is multidimensional. Changes in one area are going to affect other areas of the plan. Okay. If say that we need JAWS as a screen reader to be able to access the internet. Okay. And so we put in there the cost for a computer that, well, the increase in power in a computer needed to run JAWS. We put in the cost of the software. What about training? Okay. Does this person know how to use JAWS? What kind of training is going to be needed? So just throw in JAWS isn't enough. Will both the equipment handle it, and will the person know how to use it? Training is needed. So changes in one area affect changes in another area. Consider the entire cost of each recommendation. So with the JAWS, not just purchasing the JAWS subscription, but also including the training in there, for example. The costs provided in a life care plan do not include two important categories: potential complications and future technology. Why? We can't predict those, right? If something is more likely than not to occur, for example, if I'm a wheelchair user, as I age, my shoulders eventually are not going to last as well. They're not designed to be weight-bearing joints. So eventually, I'm going to need a power chair. That is expected, okay? As age interacts with disability, we can expect. That's not really a complication. It's something we know is going to happen. Okay. A complication could be that I am in a car accident and I lose an arm. Okay. And therefore I need a power chair because I can't do as well with just one arm. Okay. There's no way for me to predict that, right? So that potential complication, if it's more likely than not, it gets included as a recommendation. If it's not more likely than not, just possible, it isn't included in the costs of the life care plan. It's instead just listed for informative purposes in a list of potential complications. Okay. Future technology, we cannot predict that, right? Okay. Taking a look at vision loss, might there be bionic eyes in the future? Maybe. Okay. Yes, there's research in the area. Can we say, well, we expect that there will be a bionic eye available to address this person's needs within the next 20 years. So we'll include that. We don't have enough information to do that. So future technology is not included. We base it on what currently exists. Okay. Attend to details. It helps to be really picky about details and proof things very well. Your credibility depends in part on these details. If, for example, you make a math error in calculating the cost of something, that reduces your credibility. It reduces the usefulness of the document you provide and reduces your credibility. Who's going to believe you if you're making little mistakes? Okay. Consider the psychological effects of the injury or disability. Most life care plans, when you're dealing with somebody who has catastrophic injuries of some sort, counseling is going to be an important part of that. Now, we usually don't recommend, oh, once a week for the rest of your life. Who wants that, right? Okay, but take a look at what's evidence-based in terms of what kinds of crises do we anticipate are likely to happen at which developmental stages of life, and look at what kinds of counseling, what kinds of family counseling might help with adjustment and implementing the plan, things like that. Look at how disability interacts with age to produce additional concerns. For somebody who has a hearing loss, we can anticipate over time that they're likely to have decreasing vision if they're lucky enough to live long enough, right? Okay, so how do we plan for what happens when this hearing loss interacts with vision loss later in life? So what is detailed in these plans? Within each category, the specific services recommended are identified, along with the projected dates and frequencies that they're needed and a range of costs for those services. Details about specific providers of the needed service are given, with contact information for multiple providers of each service when possible. Sources serving as a basis for each recommendation, like which healthcare provider, which published clinical practice guideline, etc., are identified. The rationale for why each service is needed, like what will likely happen without it, is detailed. Enough information is provided so that families, case managers, and others can implement the plan effectively. It's a roadmap. The potential complications page. After the tables of specific services and their costs is a list of potential complications for educational purposes. Just letting people know these are potential complications. This is the kinds of things that we are trying to avoid through implementing the plan. Complications are possible problems with a low or unknown probability of occurring. The costs of complications are not included in the life care projections. If something is more likely than not to occur, such as the shoulders giving out for somebody using a wheelchair, if they're more likely than not to occur for the given individual, despite proactive preventative services, it's considered a projected need rather than a complication. And it is then detailed in the life care plan recommendations. Who uses life care planners? Okay. In forensic legal situations, you see a lot of use of life care plans in personal injury, medical malpractice cases, and things like that. It's used in healthcare and case management. I've heard it described, life care planning, as case management on steroids. Okay. Very, very helpful to have a plan to proactively, preventatively address the individual's needs. It's been considered an ultimate rehabilitation hospital discharge plan. Okay, helping prepare for that transition from intense inpatient services to what happens next. Special needs trust administrators. When special needs trusts are set up, there is an administrator who has to determine whether expenses can be reimbursed from the special needs trust, and how do they decide what is disability related and what isn't. If they have a life care plan, it's very easy for those administrators to make that decision. It's like, oh, well, yeah, it's in the plan. Obviously, this is an appropriate expense. Insurance companies need it to do reserve setting sometimes, to know, okay, 20 years from now, what are we going to have to be paying for this person? What kinds of services are going to be needed at what points in time? So how do we set aside the reserves to cover what is needed to address those services? Families, for financial and future care planning, it can be very helpful to have this kind of roadmap and know what's going to happen next. What's going to happen when I, as a parent, am gone, for example. Okay. Divorce settlements It could be either a spouse has a significant disability or children have significant disabilities, and taking a look at what are some of the disability related needs and what's it going to cost over time. What kinds of maintenance, kinds of income would be needed for that. Special needs adoptions. If you're adopting a child with significant special needs, can be helpful to know, and in some cases have some funding for some things that are covered in the life care plan. Medicare set-asides. I was reminded of the importance of this just last week when I went with my mother for her annual visit to her physician, and they asked her in the check-in process, are you here because you're participating in a research project or because of an accident? Reason they're asking about that is that if somebody else is responsible for the costs, Medicare isn't going to cover them. Okay. When there is an injury that involves a settlement or a legal judgment, Medicare has a right to both recover funds that Medicare has already paid and to deny payment in the future for services that are related to that injury. In order to get around that and to have Medicare be able to pay and to avoid a fine, because this is actually a legal requirement, there needs to be what's called a Medicare set-aside. And it's like a mini life care plan that only addresses costs that Medicare would cover. And if somebody has a Medicare set-aside approved by Medicare, that funding goes into an account, and costs of disability-related services can be paid using that account. Okay. The person can also use Medicare. If that person dies, Medicare gets reimbursed from that account for whatever it has expended. And anything left over can go to the person's heirs, but Medicare gets reimbursed. So Medicare has skin in the game as far as setting up these set-asides. This is a process that is a lot simpler. Developing Medicare set-asides is simpler than comprehensive life care planning, and therefore you can get certified in this area cheaper. And for some people, it can be a nice kind of introduction into expanding their practice related to life care planning. So do consider Medicare set-asides. The assessment process in life care planning, what is that process like? We use structured interviews of both the individual and family members. Environmental assessments, I will usually go into the person's home if possible in order to conduct a life care plan evaluation. Standardized tools and checklists are an important part of the process. Dialogue with treating service providers. It's very important that you're part of an interdisciplinary team here. And if, for example, there is something that a treating provider doesn't know about, that they probably should know about, you want to address it. You want to also find out if something that you are recommending is contraindicated by a treatment provider and why. There needs to be dialogue there. Gathering information from additional potential service providers. Okay, it may be that this person is not seeing a specialist in an area that it could be real helpful if they did see a specialist. So gathering information from specialists in those areas about what might be helpful is important. Gathering information about assisted technology and medications, things like that. Not just what they are using, but what might potentially be helpful. Um, for example, if somebody is blind and isn't using JAWS, might that be a helpful technology to implement? If somebody has non-24 sleep disorder and is blind, have they tried Hetlioz? Is a medication that can help with that circadian rhythm disorder. So they're gathering information about what things might be helpful and then going back and checking with the treatment providers. Is this appropriate? Is this something that would be helpful? And coordination with vocational experts. This is an area that too often not enough of the life care planners have the expertise in the vocational area and should be collaborating more with vocational experts and rehabilitation counselors like those of us in this webinar today. Looking at the life care plan tables, those tables include detailed projections of the disability-related future care needs, recommendations for care, the rationale for those recommendations, and itemized costs. Costs is a pain in the something, but is an important part of these recommendations because people need to make informed decisions. So getting accurate information about the costs is an important service. Gets organized into categories such as projected future medical care, therapeutic evaluations, therapies, medications, prosthetics, supplies, home furnishings, and health strength maintenance. Those same categories that we talked about before end up being headings within these tables. We don't include the cost of potential complications in the tables. It's only the more likely than not to occur items that are in the tables. And we provide sources for the providers of the services and the associated cost included in a list. The sources are included in a list at the end of the report. So the life care plan document narrative part, it's a chronological summary first of the medical and related needs, summary of the interview and any follow-up telephone conversations with the evaluee, a summary of contacts with and recommendations by treating providers, results of research about rehabilitative services and equipment that are likely to enhance the individual's productivity and quality of life, results of research about potential complications and the risks associated with the evaluee's injuries and procedures to address them, and conclusions about rehabilitative recommendations. There are standards of practice for the life care planning specialty. There's some role and function studies. The one I cited there is not the most recent, but it's the most methodologically sound in my opinion. There are standards of practice. The International Association of Rehabilitation Professionals, IARP, has a division, the International Academy of Life Care Planners, and they're currently on their 4th edition of the standards of practice for life care planners. A recently updated textbook that I highly recommend is Rutherford Owen, Barrows Bailey, and Weeds 2024, Life Care Planning and Case Management Across the Lifespan. It's an excellent book. If you're interested in this area, I highly recommend it. How to become a life care planner. If this has enticed you and you would be interested in looking at more, a prerequisite is having professional licensure or certification in a relevant area of health-related practice. And rehabilitation counseling is one of those areas, okay? Frankly, it's one of the best areas of preparation for becoming a life care planner. Specific educational requirements related to life care planning. You need at least 120 hours in specified content areas. Okay, there are various options for obtaining required training. I'll provide some links to those at the end of this presentation. In terms of cost, for online training. You're looking at maybe $5,000 or $6,000 for getting the training that's needed to become a certified life care planner. Maybe about half that to specialize in Medicare set-asides. So just in terms of budgeting, think about that. There are various options for certification as a life care planner. There's an organization that certifies nurse life care planners, one that certifies physician life care planners. We as rehabilitation counselors fit very well within the International Commission on Healthcare Certification's Certified Life Care Planner, CLCP credential. That's the one that I hold. And I would recommend that one. Other ways to be involved with life care planning. You could collaborate. Collaborations between life care planners and vocational experts as integrated teams. I have sometimes, as a vocational expert, accompanied a life care planner going into an evaluation in the home. And it's been really nice when we can combine those efforts and work together. So those integrated teams can be helpful. Some of us can be an integrated team in and of ourselves. We can do both the vocational expert work and the life care planning work. Sometimes people hiring like that. It can be a little bit more efficient to have one person do both roles. Consulting with life care planners to provide vocational rehabilitation recommendations for life care plans. I just a couple months ago had somebody contact me asking me to provide the vocational rehabilitation recommendations part of her life care plan. As I got to talking with her and the hiring attorney, we got some clarification that they really needed a vocational expert as well. That they needed more than just the rehabilitation plan. They also needed to look at loss of earnings capacity and things like that. But it's possible to just be providing the voc rehab recommendations for life care plans and informing potential users of life care planning services. It may be that you work with somebody who could benefit from a life care plan. So letting them know that this kind of service exists out there can be helpful. Resources. I'm highlighting 3 here. One is the Foundation for Life Care Planning Research, which did transition to IARP to evolve into the Foundation for Life Care Planning and Rehabilitation Research. It's a little bit more broad, but the original Foundation for Life Care Planning Research website still has some really helpful introductory information. So I'm providing that website for you here. The International Academy of Life Care Planners, again, a division of IARP, has some great information. And if you want to take a look at the Certified Life Care Planning credential at the ICHCC, here's a link for that. And the ICHCC also provides then links to approved providers of educational services. So if you want to pursue that credential and want to get your 120 hours in the specified areas and make sure that it relates well to the credential you're seeking, I would recommend one of those providers. Okay. Oh. Okay, some references here. And again, I'm going to make this available to everybody who's participating today. Come on. Okay, so then, questions. What else would you like to know about life care planning? I can show you an example, perhaps, if that's something that you would like to do at this point, and want to clarify that for follow-up after this, contact me at creid@vcu.edu. That's creid@vcu.edu. So what else would you like to know? I want to stop sharing and be able to see your faces again.
Thank you, Dr. Reid. That was very, very interesting. Good information. There's a couple of questions in the chat here.
Oh,
One,
great.
I can ask you, and everybody else can chime in also as you'd like to.
Thank you.
We have regarding costs for training, do any organizations offer assistance for funding? So for becoming a life care planner, are there any that you know of?
I do not know of any at this point.
Okay.
Yeah, that's a great question. That may be something that somebody would want to fund someday.
Mhm.
Yeah.
Yeah. Yeah. What about are there many agencies hiring life care planners? Is another question.
Great question. There are private practices that specialize in life care planning that are a great place to get an initial start, to work with an experienced life care planner. If your goal is someday to work on your own, it can be really helpful, to work with somebody who's experienced first. So even just do an internet search of life care planning services in your area. See, is there somebody in Norfolk, Virginia, for example, that does life care planning? And just even do an informational interview. Reach out and say, I want to learn more about life care planning. Can you tell me more about this? And learn about what their organization does, and see whether that's something that you might want to be part of. That can be a real nice way to get some experience. Um, and I do recommend getting some experience if you can. Or another thing is to connect with folks who are willing to mentor. I know that IARP has a mentorship program, where they can have life care planners who would be interested in mentoring new professionals, and looking at those kinds of connections too.
Great ideas. Did
Yeah,
I hear you mention that you might be open to sharing a plan? We
I
just
can
that
do
possibility.
that.
I have other questions. I'm not seeing other ones in the
Okay.
chat, and I was just thinking that sounds really informative too. So
Okay.
put
Let me
that.
share one page from like a 45 page plan just so we can look at a table. How does that sound?
Great.
Okay. All right. So let me share. This is from the sanitized case study that I've asked ARCA to share with everybody. So here is the page for Betty Williams. And she is a young person who is blind, who is a college student. And this is an example of the kinds of equipment needs. So we have here, uh, you see, additional memory for a laptop computer. Additional memory. Why don't I put in the cost of the regular laptop computer? Well, life care plans focus on disability related needs. Most people these days have a laptop computer, right? But does that laptop computer have the additional memory that's required to run the software like JAWS? Okay, so we have what's the description of the item, at what age is it initiated, through what age, what's the cost, how often is it needed? In this case, every 5 years, the annualized cost, or the one-time cost. So if it's something that's just done once, it would go in this column. If it's done, say every 5 years, we put it in the annual cost column. Okay, and we see a whole bunch of different pieces of equipment that have been recommended. And in this case, it's because it was recommended by the Lighthouse for the Blind that this individual worked with. These are the kinds of tools that she has had recommended or is currently using. Okay, so that's an example. And if you want to see the entire thing with narrative and uh, all kinds of things, um, then you can see that in what will get sent out.
Thank
Okay,
you. That's really interesting. Yeah.
sure,
Yeah. It's
sure.
helpful. I can see it being helpful also for clients to have a better understanding of what they're facing or what the road ahead looks like too, and having, that. I'm
Yes.
curious, And please feel free to include any other questions in the chat too. I'm just double checking here, anything that
Yeah.
anybody has. Um, I was curious throughout about the biggest challenges that come up. This is a bit of a broad question, but for both for
Sure.
clients and then also for life care planners, and that can be like, I don't know, cost considerations. It could be literally anything.
Yeah, yeah.
Um,
I would say probably the biggest pain, but the biggest annoyance is trying to get cost information from folks who don't want to provide it. That would probably be one of the biggest challenges. Other things can relate to it can be really challenging trying to get information specific to the individual if you've got a situation where the individual isn't able to communicate very well. How do you gather information from somebody who's got minimal language skills, for example? Then it takes a bit more in terms of your creativity and being able to understand. I had, for example, a situation. Now this was for the vocational evaluation uh, aspect. I wasn't doing the life care plan with this individual, but somebody who was deaf with minimal language skills. We needed to bring in a certified deaf interpreter as well as regular certified interpreters. Um, the CDI is somebody who's experienced in working with somebody who has minimal language skills. And so the process is I would explain something, the interpreter would interpret it into American Sign Language, the CDI would then interpret that into something that somebody with minimal language skills can understand. And that CDI has experience and training in how to do that. I don't. So even though I have a background in deafness, I don't have that much experience working with somebody who's got minimal language skills. So the process of trying to gather information from someone like that is probably one of the bigger challenges. Uh, the the annoying parts is the trying to get cost information. The bigger challenge, how do I gather good information from the people who can provide it?
that makes a lot of sense. Is there there's probably no standard timeline for how long these take, but as a former case manager, my brain goes straight to that sounds very time intensive. What is that like for life care
It
planners?
it is very time intensive. Yes. The process can sometimes take over a year. Sometimes you're told by the referral source, I need this next month. And you have to then figure out whether you're going to take that referral. Can you drop everything else and focus on this intensely for a month or not? So yeah, it takes a lot of hours to be able to do this right. Absolutely. Hmm.
We got any other questions from anybody else? I don't want to hog the floor on asking things, so
Yeah.
I think
And
yeah, go ahead. Yeah.
I was kind of curious, had people answer what's their relationship to life care planning? I see a variety of responses here. So for any of you who have more experience than others, see, we've got the range from I know nothing about this to I'm certified. Is there anybody who'd like to add anything from their perspective about providing life care planning services? Please pop that into the chat. Okay. Oh, we've got a question. Can you talk about the cost for your services? Are there differences between private pay patients versus someone involved in litigation? In my practice, I charge a standard rate, but I have a sliding scale. So if, for example, I'm working with a family who does not have significant means, that scale is going to slide way down per hour. Um, when it comes to services in a legal situation, I that scale does not slide down. I keep it at a certain rate per hour. Um, I will say that my rates are probably at the higher end because I've got a demanding day job and I don't want a lot of private practice. Um, but there are others who charge more than I do. I charge $3.50 an hour, and that's for whatever I do. But again, I do have the scale slide down for work that benefits directly people with disabilities. And so that's the way I handle that. I do charge the same regardless of what I'm doing. So if I'm testifying in court, some people will have different charges for that than for the rest of their work. I don't, because I say I charge for my time. I'm not charging for testimony. I charge for my time, and I just charge the same thing, um, unless there's a sliding scale involved.
The reason I asked that question was a couple years ago when I started at the university here, one of our professors was certified in life care planning, and
Yeah.
I had sustained an injury, and
Hmm.
I could have used those services.
Yeah.
And one of the questions that person asked me was, would you have paid for it out of pocket? And I said, yes, because that would have been so valuable to me to
Right.
know what I needed to prepare for.
Right.
So, I guess if I can ask another question is,
Yeah.
how does someone in the general public find out about life care planning?
Yeah. Yeah. That's a great question. I think it needs to come from referrals from people who know about it. And that, they're not going to know to Google life care planning, right?
No.
So it has to be that, maybe a physical therapist says, "Hey, have you considered working with a life care planner?" Maybe it's a rehabilitation counselor who says,
Mhm.
life care planning services exist. I- if the person is in a litigated situation, it's a lot easier to bring up, has your attorney talked about working with a life care planner? If the attorney doesn't know what one is, can we provide some information to that attorney? That can be a kind of advocacy that can be
Mhm.
helpful.
That's what I was thinking. In my particular situation, um, I had sustained a TBI and did not have um, coordinated services, let's say,
Yeah.
afterwards, which is very common. Um,
Yeah.
there was long-term disability, so I was in a long-term disability issue with the company that I worked with. But yeah, that was never something that was talked about or offered. So I'm wondering if you would think disability lawyers would always be familiar with that, but maybe they aren't. I don't know.
Sometimes they're not. Yeah. Yeah. We need to do it some more education. Uh, Often disability lawyers don't know how important this could be to them and to their clients. Yeah.
Yeah, I think it would make a big difference.
Yeah. I see somebody asked, are people afraid to discuss life care planning? Um, I would say it depends probably on how you present it. If you say, we want to develop a plan to maximize your quality of life and minimize complications, I think that's a kind of language I'd like to hear as a person with a disability, right? So it depends on how you present it, I would think. I want to thank everybody for your time today. It's been a pleasure talking with you, and I encourage you to follow up with me at creid@vcu.edu. Thank you very much.
And ARCA would like to express our sincerest gratitude to you, Dr. Reid, for taking time to talk with us today. We really appreciate this presentation. Um,
Thank you.
for those in attendance, we appreciate you joining us today. And just a reminder to go ahead and fill out the evaluation at the end if you haven't done that already. For those, I have a message for those who identified as iPhone today. If you can put the letter, let's see, put the letter J in the chat. I might be reading the message wrong here. If you can put a letter J in the chat real quick, that would be really helpful to Vicky in keeping track of who all attended. And then for our next presentation, we would like to invite you to save the date for a webinar scheduled on August 15th at noon Eastern Standard Time. And that'll be titled Medicare and the Counseling Profession, 10 Things That You Should Know, and with Dr. Matthew Fullen. So webinar registration and more information about that will be available on the ARCA website.
Amy,
Yeah.
the person identified as iPhone, can you put your name in the chat box? And the person identified as J, could you put your name in the chat box?
Thank you, Vicky. Sorry about that.
Okay, it looks like okay, I got the J identified. iPhone, I think you're Jessica, but I don't. Oh, Jessica, there you are. Thank you, ladies.
All right.
Well, everybody have a really good weekend. Thank you for attending.
Thanks all.
Thank you, Chris. That was great.
Oh, thank you.
Yeah, it's been around for a while. Because I can remember one of our ORA members being a life care planner, and it was kind of new and interesting at the time. It's like, why would you become one of those? Well,
yeah.
yeah.
Hopefully you got some more information about why.
That was really helpful. I have some voc rehab background in the CRC, and I know of life care planning, but this just fleshed it out completely, and it's super helpful for like my existing clients too. So thank you.
Good.
Yeah.
I'm glad you found it helpful. Thank you, Amy.
Yeah.
Well, when I approached you, I knew I had a winner. So thank you, Chris. I so appreciate it. I told you I was going to do it. I held you to it.
I appreciate it. Yeah, that's a good thing.
It
Yeah.
is. Well, thank you so much. Have a lovely weekend. And you know where I am. Please don't hesitate to reach out. I look forward to connecting a little bit more.
I like that. Thanks a lot, Christine.
Bye-bye. Thanks
Take care.
all. Thanks, Amy.
Yeah,
Thanks,
bye.
Vicky.
Sure thing. Have a great summer, Chris. And
You too.
Chris, I'll send you a summary of the evaluations, probably the first part of August, because tonight I'm supposed to be going on vacation for 2 weeks and not working.
Enjoy your well-earned vacation.
Thank you. I'm looking forward to sleeping in and spending time with family.
Sounds good. Sounds good. You take care, Vicky.
Thank you so much for a great presentation.
Thank you. Appreciate it.
All right. Toodles.
So long.